A relaxing Swedish massage is comprised of various strokes which, when combined, form a flowing rhythmical sequence over the whole body. Each stroke has a certain effect within the body and prepares the tissues for the next stroke. Palpation is a technique that is used to assess the condition and structure of soft tissue and bone. Palpation is performed by applying sensitive pressure with the hands in contact with the body. This may be done through the towels or directly on the skin. A therapist uses this technique at the beginning and throughout treatment to discover the nature of underlying tissues. The therapist can then modify and individualize treatment techniques to adapt to each individual client. Using touch in this way is an important part of maintaining healing connection with the client. Effleurage, from the French to stroke lightly, is the most superficial of all strokes used to spread massage oil and define the area to be massaged. It is a long flowing stroke with hands moulded to the body. This technique is delivered in a lunging posture, one foot in front of the other, leaning the body weight into the stroke. This stroke is usually used at the beginning and end of every massage, as well as between other strokes. It accustoms the client to the touch of the therapist, promotes relaxation, and prepares the body for deeper strokes. Effleurage assists in aiding circulation, warming the body's tissues, and providing gentle stretch to the muscles. Petrissage, from the French to knead, is a deeper stroke that penetrates more firmly into the tissue. It consists of rhythmic kneading manipulations which press and roll the soft tissue. It is delivered with the therapist's back straight, knees bent, allowing the pelvis to sway, counterbalancing the movement of the hands and arms in a dance-like movement. The kneading motion of Petrissage serves to milk the muscles of waste products. Friction is the deeper stroke performed by small circular or sliding movements with the thumbs, pads of the fingers, or heel of the hand, according to the area being massaged. This technique is delivered with pressure derived from the therapist's body weight in a lunge-like posture, one foot in front of the other. Other forms of friction are transverse friction, that moves across the grain of the muscle, rectilinear sliding frictions that move along the grain of the muscle. It is useful for creating heat in muscle tissue. Friction is also used to massage deep into the joint spaces or around bony prominences such as the patella or kneecap. Always check with the client when increasing stroke pressure. Vibrations are a group of techniques that consist of rhythmic manipulation of the soft tissue, which initiates reverberation effects within the body. Vibration involves the rhythmic, tremulous movements using the whole hand and fingers. Rocking is rhythmic movement applied to the full body. Shaking is applied to the legs and arms. Tapotement, from the French to drum, are a series of techniques applied to the fleshy parts of the body, like the buttocks, back or chest, but not directly over bone. It is delivered with the therapist's back straight, knees bent and wrists loose, with rhythmic alternating hands. When using the Tapotement technique on the back, the kidney area is always avoided. There are several types. Hacking, with fingers separated loosely. Strike the body so only the little finger actually comes in contact with the body. Cupping, performed with cupped hands, where only the edges of the cup come in contact with the body. Apply cupping to broad areas such as the chest or back. This is the stroke of choice to promote expectoration of mucus from the lungs. Pummeling, using the ulnar surface of the hands in loose fists, pound and rebound off the body, applied only to the fleshy parts of the body. Plucking and tapping can be applied to facial tissue or sensitive areas. The skin is gently plucked by the thumbs and forefingers. Tap lightly in a strumming motion with the finger pads. As a consequence of any tapotement technique, the body's cavities and organs are influenced by ripple and rebound effects, normalizing the body's homeostasis. Passive movement is applied to a limb or joint where the client remains relaxed and does not assist in any way. Passive movement can take the form of gentle manipulation, rotation, or stretching within the normal range of motion. Take care to get feedback from the client as to their comfort level with these movements.